Thank you, one and all, for being here to talk about Emeriti. I do recognize some faces, so I think some of you have been through the discussion about Emeriti before, but you're certainly welcome to hear again. I know for myself, I've let people know this, it took me probably a good 4 times of hearing about Emeriti before I really got what it was about, so don't feel bad if you're in that group. I'm Carrie McCrimmon, in case you don't recognize me. I'm the person who sends out all those emails. And we have Joe with us from Emeriti, and they come out once a year to give us an update, what's going on with Emeriti and the benefit in general. So I'm going to just go ahead and turn it over to him, since he's the one with all the info, and let him go. And if you have any questions after Joe's left, please feel free to ask me, but please use him while he's here. So thanks again for coming, everybody.
Thanks, Carrie. As Carrie said, my name is Joe Minini. Have a seat. With Emeriti, I'm the Associate Director of Marketing, and this is our annual on-campus visit where we kind of update you on what's new and exciting for the Emeriti program and kind of walk you through the basics of how the program works. Maybe by show of hands, could you just raise your hand if you've listened to or sat in on any of workshops in the past years? I know I recognize a few faces. Okay, so we have a few people that have sat in on it. What the presentation that we're going to do this afternoon is for those that are nearing retirement, but there's also some information in there for those who are retired. So we'll kind of walk through some of the updates for the insurance plans for those of you who are actually participating in those. And I'll be here after the presentation, so if you have any additional questions, feel free to come up, and I'd be more than happy to answer any of those questions you might have. So with that, what we're going to cover today is essentially how the Emeriti program works. So for those of you who this is your first time sitting in, we'll go through the nuts and bolts of the program, why you need to save and invest for healthcare expenses in the future, why that's so important. What if you want to retire before Medicare eligibility? How does this program coordinate with that? Retiring after Medicare eligibility, again, how does that work? And how do you plan for your future decisions at this point? So we'll kind of walk through, again, the basics of the program. This is a program that has been implemented here at SPU probably for the last couple of years. It's been put in place, and SPU recognized the need for retiree health benefits as part of your overall financial planning. So not only from a pension plan side, but another key component of retiring is actually, will I have access to good guaranteed issue health insurance, as well as dollars to pay for it. So the university has implemented this program in a way to help you or assist you in your retirement. Now, the Emeriti program, some of you may have heard this, some may have not. I'll go through it relatively quickly, but we're a nonprofit organization. We've been around since about 2000 timeframe. We were developed through a study research work done by 2 academics, Ken and Linda Kuhl. They basically did this supported by a grant from the Mellon Foundation, and they went crisscross the country to various universities and colleges, basically looking at the correlation between if there was existing retiree health care access to or subsidy for, whether or not the population was retiring on a timely basis or not. And what they found was at those institutions where there was no retiree health benefits, access to plans or actual subsidy to these plans, that they were seeing a delayed retirement. So people weren't retiring when they thought they might be able to. And a matter of fact, it was up to 3 years that people were staying on longer, and in some cases even longer than that. So the Kuhls went back to the Mellon Foundation and said, this is our findings, and the Mellon Foundation essentially said, well, now what are you going to do with it? And that's kind of how the Emeriti program was born. That was the beginning of 2000. It took several years after that, working with all of the agencies, the SEC, the IRS, the Department of Labor, the 50 state insurance departments to finally get the program off the ground, and we launched the program in July of 2005. And again, we are a nonprofit, consortium-based organization that works mainly with higher education institutions across the country. We just got approval from the SEC to expand into other education-related organizations, such as museums, libraries, teaching hospitals, research institutes. So we're branching out into other educational related organizations. And right now we're the only organization that provides this comprehensive benefit that we're going to talk about today from a savings standpoint, as well as access to guaranteed health insurance. And at any point, if anybody has any questions at all, feel free to stop me. So the overarching theme of the program, as far as who are the players involved, Emeriti is the convener of the consortium. We oversee the consortium, we manage the consortium, we do all of the communications, and we choose all of the business partners that we work with and monitor how they do. The business partners that we're currently working with, you have two prominent names in the retirement arena. Fidelity will be managing all of the investments that are in these accounts, as well as doing all of the record keeping. And Aetna will be underwriting all of the health insurance plans from medical to prescription drugs to the dental plan. So those are kind of the players involved. We oversee our business partners for the services that they provide. Now, from an institutional standpoint, Emeriti has a basic plan, and then at each institution customizes that plan. So we're just going to kind of walk through the customized SPU plan and how it will affect you. First of all, when am I eligible? Well, if you're a benefit eligible employee, you're going to be eligible to receive this benefit at some point. When does my employer start making contributions? Most of you in this room probably are already receiving contributions. Here at SPU, contributions start at age 35, okay? And currently, they will be making a contribution of $73 a month on your behalf into these accounts, and the contributions are going to continue for 25 years or until you retire, or unless you pass away, but then you don't have to worry about it. But once you retire or have received 25 years of contributions, the contributions will cease. When are you vested to use the money? And what that means is when will you actually own the dollars that the university is putting into your account? And here at SPU, the vesting criteria is 7 years, and 7 years of service. So regardless of when this program was put into place, as long as you've had 7 years of continuous service, you will be fully vested. So many of you, if you've been here already for 7 years, the dollars that are in that account will be yours if you leave the institution for any reason. Yes?
If you pass a certain age without reaching 7 years, like if you pass age 60 and leave after 6 years?
No, it's 7 years, and it's what we call cliff vesting, so it's not prorated. So if you leave after 6 years, it's not a prorated benefit. You have to make that 7th year in order to be fully vested for the employer contributions, right? So after 7 years, you own the dollars that the employer puts into the account. In these accounts, as you'll see in a little while, you're going to also have an opportunity to make voluntary contributions. Any voluntary contributions you make into these accounts are automatically 100% vested. So you own those immediately, so if you leave, obviously, those dollars go with you. When can I access the health account? The health accounts, to utilize the dollars that are in there, you need to be at least 55 years of age and have terminated employment from the university. So once you turn 55, anytime after that, whether you retire or terminate employment and move somewhere else, you'll start to be able to use the dollars that are in the account for the reimbursement benefit that we'll talk about in a little while. There are a couple of other situations where you can use those dollars earlier than that, and we'll discuss those also. Now, when am I eligible for the Emeriti insurance? You'll be eligible for the insurance, and this is the eligibility criteria, once you reach the age of 60 with 7 years of service. So if you're here at SBU, you're 62, you've got 30 years or 20 years of service under your belt, you decide to leave and go somewhere else, you've met that eligibility retirement, and when you turn 65, you'll be able to participate in the insurance program. Yes?
Is years of service a time factor or an FTE factor? If you're a part-time employee, that's not a full FTE. Does it count as a full year of service?
It would, your time would count in a benefits eligible class. So as long as you're in a benefits eligible class, that's what they would count. Right. Yep. So to have access to the insurance, again, it's age 60 with 7 years of service. Now, the three core components of the Emeriti program, basically it's like a three-legged stool. We have the health insurance accounts, which are the accounts that are going to receive the contributions by the university, as well as by you if you decide to, on a tax advantage basis. They're going to grow during your working years, and then when you retire, you'll have access to those dollars, assuming you met that vesting criteria. The second leg of the stool is the health insurance options. And again, once you meet that eligibility criteria, you will have access to guaranteed issue group health insurance on a national basis when you retire and turn 65. And then the third component of the program is a reimbursement benefit. And that reimbursement benefit is essentially like a flex spending account for retirees. So you'll be able to use the dollars in these accounts to reimburse yourself back on a tax advantage basis for things that may not be covered. And we'll talk a little bit more about that as far as what are some of the things that you can actually reimburse yourself back for. So during your working years, why do you need to save? A lot of people assume that Medicare is going to cover most of their expenses in retirement, medical expenses, and that simply is not the case. Currently, Medicare covers about 51% of your medical expenses in retirement. That number used to be a little higher, and it's probably going to be a little bit lower in the future. So you really need to think about saving dollars for future medical expenses. About 20% of your expenses in the future are going to be out-of-pocket expenses, things that Medicare may not cover or supplemental insurance may not cover, and about another 20% will be covered by the supplemental insurance plans that we're going to speak about in a little while. So each year, Fidelity does a study, and they look at a couple retiring today, this is for 2010, if all they had to rely on was Medicare, what would their expenses be for their actuarial expected lifetime? And for 2010, that couple, if all they had was Medicare, would have to have put aside $268,000 over their lifetime to cover medical expenses. I don't know about you, but I don't have nearly that in my savings account, let alone set aside for health insurance. So you can see there really is a need to start to think in the future, what am I going to need to be saving for? When you retire, your medical expenses more than likely are going to account for at least a third of your total expenses in retirement. So you really need to start thinking about putting some dollars away for medical expenses. Now, the health accounts during your actual active years, working years here at SPU are going to work like this. The employer is making the contribution, and again, as I mentioned before, it's roughly $73 a month currently. And those dollars are going in on a pre-tax basis. They're going to grow tax-free, and they're going to come out tax-free. You also have an opportunity to make contributions into these accounts as well. So you'll have two trust accounts, an employer VEBA, which is a voluntary employee beneficiary association, and that's where the employer dollars will go in, and then you'll also have an employee VEBA account, which you can make contributions into. Your contributions will go in on a post-tax basis, so an after-tax basis, but are going to grow tax-free and also come out tax-free. So it's kind of like a Roth account for your employee contributions. So that they're going to go into this, these invested accounts that we'll speak about in a little while that Fidelity manages. They're going to grow during your working years, and then when you retire, they're going to come out in either one of two ways. You're either going to have them come out to pay for insurance premiums through the Emeriti program, or to reimburse yourself for qualified medical expenses or insurance premiums outside of the program. Okay, so dollars are going in during your working years by your employer, by you if you choose to, on a voluntary basis. They're growing on a tax advantage basis, and then they come out for either qualified medical expenses, reimbursement, or to pay insurance premiums. To give you an example of the magnitude or benefit, if you will, of the tax advantage of these accounts, suppose you had a $1,000 medical bill and you had to pay that bill and you wanted to take money out of an account, and your two options were either to take it out of the Emeriti account or your 403B account. Well, if you take it out of your Emeriti account, those are tax-free dollars. So you would take out $1,000 to pay a $1,000 bill. So essentially you'd get 100 cents on the dollar. If you took the dollars out of your 403B account, those are growing tax deferred, but when you take those dollars out, you actually have to pay taxes on them. So to pay that $1,000 bill, assuming a 28% tax bracket, you'd have to take out nearly $1,400 out of your account. So you can see the advantage of having both type accounts in retirement to pay for various expenses. So where does the money go when you're putting the dollars in, when a university is putting them in, when you're putting them in? Well, Fidelity, as I mentioned before, is the investment manager. And there's a couple of different areas that the dollars will be going into. One will be the Fidelity Freedom Funds, one will be the Fidelity Money Market Account, and then there's also a Fidelity Treasury Money Market Account. And the Fidelity Freedom Fund is a life cycle fund. I don't know, are any of you familiar with the life cycle concept? No? Yeah. It's really a nice safety net, and that's one of the reasons that Emeriti chose the life cycle freedom funds. It's basically, there are various funds with different years attached to them. And the years are associated with your retirement age at age 65. So there are 12 funds currently, and each one of these funds is a fund of funds, if you will. There are 22, 23 underlying funds in each one of these funds, and your dollars will be deposited into the fund that most correlates to your retirement age at 65 if you do nothing. So for example, my retirement age is at 65, the fund closest to that would be 2020 funds. And if you picked up any of the material up here, some of you may have the little pie charts there that show the years associated with the funds themselves. So your funds would go into the most age-appropriate fund for a retirement age, assumed retirement age of 65, and you have the opportunity to reallocate those dollars at any point. So if you're a more aggressive investor and want to invest more in equities in the stock market, you could put your dollars into more of a fund that's out further, a 2045 or 2050 fund, and you'll have a longer horizon to invest. It's a little more aggressive, a little more risky, but the return might be a little bit more. And on the converse side, if you are more conservative, you can move it into a 2005 or 2000 fund, which has less equities in them. But you always have the opportunity to move the dollars around. And as I mentioned, if you don't move those dollars around at all, if you don't direct where they're going to go, they'll automatically be allocated into the most age-appropriate fund, assuming age 65 retirement. And the nice thing about the life cycle funds is that, in my case, my dollars are in the 2020 fund. As I'm getting closer and closer to retirement, my 2020 fund is going to start looking like the 2015 fund, and then the 2010 fund after 10 years. So it's going to become more conservatively invested over time So I'll always be appropriately invested. Yes?
Going back to how you put money into those funds, you said that the money that the employee contributes is post-tax, so we pay tax on it
Correct.
before it goes in.
Correct.
403B, we do not pay tax when it goes in, we pay tax when it comes out.
That's correct.
So we paid, the theory being that you're probably in a higher tax bracket when you're earning money than when you're retiring. It is kind of the theory behind it. So I guess I'm not clear why you would be better off putting aside money I've already paid taxes on into this plan than just putting a pre-tax into a 403B when I'd probably be paying less than 28% when I actually need it.
Right, and that may be the case, but it's not necessarily. A lot of us think we're going to be in a lower tax bracket, but 20 years from now, who knows what the tax bracket will actually be at that point. But yeah, if that, yeah.
Because I just want to make sure I was understanding.
Yep.
This is you're paying taxes and then putting it in. The 403B, that's pre-tax. So
Right. So this aligns itself to like a Roth IRA. Yep.
Okay.
Yes.
Because any appreciation, any gain won't be taxed.
That's correct. Yeah, any gain you earn on those dollars that are put in there will be tax-free. They'll grow tax-free, and when you take them out for disbursement, they'll be tax-free. Right. Yeah. So that's how the life cycle funds work. And then you also have, as I mentioned, those other two accounts, and given today's economic climate, some people have gravitated towards those as a safe haven, if you will. We've just added the treasury money market last year to give people some more options. So again, you can allocate your dollars as well as the employer dollars when you're investing. Now, in your retirement years, how can you use the reimbursement benefit? Unlike your 403B account, you can continue to make voluntary contributions into these accounts in retirement. Those would be, as opposed to a payroll deduction, those would be on a lump sum basis of $100 or more. And again, they would be put into the health accounts. They would continue to grow on a tax-free basis, and then you would be able to use the dollars to reimburse yourself for qualified medical expenses. Now, who would be able to use? Oh, yes.
Could you back up a slide,
Sure.
please? So I'm just making up a fake number, but let's
Sure.
say I decide to contribute after retirement. Let's just pretend, 50,000.
Okay.
I don't know over when, but my own money.
Sure.
Okay. So, and then I can withdraw from that money in order to reimburse myself for expenses, right?
Correct.
But what if I die before I've gone through the 50,000?
Good question.
Does that money go
Yeah.
to my wife?
Yeah, the way that works is it's a little different from your 403B plan because this is a health and welfare plan. And then I'll back up and go through the two scenarios. One is employer contributed dollars that you're vested, and one would be employee contributed dollars. The way it works is you would have access, your wife would have access to the dollars in the account to pay yourself back. And here at SPU, any eligible relative, dependent relative, would also be able, their expenses would qualify. So if you were maybe taking care of an elderly parent or in-law, any expenses they incurred, as long as they met the federal IRS guideline or definition of a dependent, you can reimburse yourself back for them. So you're going along, using your dollars, you pass away. Your wife has access to those for the rest of her life. She goes along, she passes away. And you were taking care of your mom, who somehow lived to 98. And so she's still able to use those dollars. She passes away. In the outside chance that there's still money left in there, the employer contributed dollars would come back to the university to offset future expenses of the plan. So they would stay within the plan. Your dollars, if you put those $50,000 in and there were still some dollars left, would actually come back to the community here, and anyone who had made voluntary contributions like you did would share in, so you'd have $10,000 left. Everyone else in this room has made voluntary contributions. You pass away, your wife, your mom, everybody here would raise a toast. Yeah, right, exactly. everybody here would raise a toast and say thank you, and they would all share equally in that remaining $10,000. So that's how that's handled, right? So now who can use the benefits? And we kind of just walked through this in that example we used. Essentially yourself, your spouse, any dependent children before the age of majority, 19 or 24 if they're still in college, permanently disabled children if they're disabled prior to the age of majority and have access to that for their lifetime, and then any dependent relatives as we just said. What are some of the things that you can use the dollars for from a reimbursement standpoint? Again, as I mentioned before, it's kind of like a flex spending account, only for retirees. So if any of you are participating in the flex spending account during your active years, many of the same things that are covered now will be covered then. This is kind of an abbreviated list. If you have nothing to do at all and want to read the IRS code 213D, feel free, but that'll give you a more detailed list. But some of the things that you can use to reimburse yourself back for, and this is a big one, is your Medicare Part B premiums. Because when you retire, you still have to, and you enroll in these insurances, you have to be enrolled in Medicare Parts A and B. And Medicare Part B has a premium associated with it. It's roughly around $100, give or take a few dollars. So you can pay yourself back each month for those premiums. Supplemental insurance deductibles and co-pays. So the insurance plans that we're talking about today, obviously some of them have co-pays and deductibles. You can reimburse yourself back for those. Any vision, hearing, dental expenses. Over-the-counter medication, this is something that has changed somewhat with the new Healthcare Reform Act. Before, you used to be able to, any over-the-counter medication, reimburse yourself back for in the flex spending account. As of January 1, to be reimbursed for over-the-counter medications, you'll need to have a prescription from your doctor to get reimbursed for that. So you can still get reimbursed, but you need to have a prescription. Medical equipment, long-term care insurance, you can reimburse yourself back for that. Medical expenses associated with nursing home expenses, and then other post-65 and pre-65 premiums. So what that means is that if you decide to retire early, retire at 62, and I know here at SPU, they allow you to stay on the plan until you're 65, but you have to pay the premiums. So you can pay the premiums, and if you wanted to, you can actually reimburse yourself back for those premiums with the dollars that are in this account, okay? And then the other part of that, what that means, other post-65 insurance plans, is that when you turn 65, say the day you turn 65, you're going to retire and enroll in Medicare Parts A and B. You take a look at the plans that we offer, and you say, well, I really like an AARP plan better than these Aetna plans. And you have the choice to choose between them. You can take the AARP plan, but once you make that choice, Aetna wants you to make the decision when you retire, and they want you whether you're healthy or you're sick, because they're trying to avoid adverse selection. So you need to make that decision when you retire at age 65. You have the ability to go outside the program and take insurance, but you can't come back in forever, except if there's a qualifying life event. So for example, you retired at 67, your spouse was 63, she or he still has coverage, and you're covered under that plan now. And then they turn 65, they retire, and they lose coverage. That's a qualifying event. So then you could come back in and participate in these insurance plans. Okay? So how do you access Medicare and Emeriti health insurance? Again, as we mentioned, you have to be at least age 65, you have to be retired, and you have to have enrolled in Medicare Parts A and B. And I'm not going to go into detailed analysis of how Medicare works, but just kind of a brief synopsis. Essentially, the original Medicare has two parts, Part A and B. Part A is your hospitalization, and Part B is your medical coverage. And you have a choice of doctors as long as they accept Medicare. And then there's Part C, Medicare Advantage Plan. And in the Medicare Advantage Plan, what you're essentially doing is you're assigning your Medicare Parts A and B rights over to a private carrier, and that private carrier then becomes primary. So Medicare is out of the picture, and the private carrier is now your primary payer. So you would choose either the original Medicare, a Medicare Advantage type plan, and then you also have Medicare Part D, which I'm sure all of you have heard about by now, and that's your prescription drug coverage. And again, that's offered through private insurers, and there's various levels of coverages and premiums and plans to choose from. And this is how Medicare works, so it's not how the Emeriti program works. What's changing in Medicare? Medicare this year, the CMS has been very slow at announcing some of their changes for 2011. So as of Monday, when I left the office, we still hadn't heard back on some of these. Your Part A deductible, which is your hospitalization, in 2010 was $1,100. We don't know what the new deductible is going to be for 2011. Your Part B deductible in 2010 was $155. Again, we're waiting to hear what the 2011 deductible is going to be, and it should be any day now. Part D deductible, that's your prescription drug coverage. That's going to stay the same. That was $310 last year. It's going to be $310 in 2011, as well as your Part D true out-of-pocket expense. In other words, once you've reached that amount, that's when the plan that you're on will pay either 95%, or if you're in one of our richest plans, 100%. And the Part B basic premium, again, it was $96.40 in 2010 for anyone that was already in the program. Again, we're waiting to hear back from CMS on that. Yes?
On the out-of-pocket prescription, I thought that donut hole is being phased out, correct?
There's some changes coming in the future for the donut hole. Last year, they offered an immediate, if you hit the donut hole, $250 credit reimbursement. This year, there will be a 50% discount on named drugs at point of purchase once you reach the donut hole. The plan is sometime by 2020 to close that donut hole, but a lot's going to happen between now and then.
4,500 was still is that what that donut hole was right now? So you're not really saving anything.
Yeah, that hasn't changed. Yeah, what you'll do, you'll save on those name brand drugs, the 50% discount at point of purchase if you hit that donut hole.
Okay, but still isn't going to pay 100% until you get 4,550.
Correct. Well, 95% is actually what it'll pay. Yeah. Unless you take one of our richest plan, which will then pay 100%. Yeah, after that. Right. Yep. So what are some of the things that Medicare doesn't cover? There's deductibles, co-insurance, coverage while traveling abroad. If you have an emergency, medical emergency while you're traveling abroad, Medicare doesn't cover that. Our plans actually have some coverage for that. Long-term care, foot and orthopedics, dental, routine vision, and eyeglasses. So there are a number of things that Medicare does not cover, and that's one of the reasons that you really need to think about offering or choosing supplemental insurance. Now, when the Cools went and did their research across the country, they interviewed retirees and people that were getting close to retirement, and really tried to focus in on what were some of the key attributes that people would like to see in their plan design for the insurance that we offer through the Emeriti program. And this is a partial list of some of those items. All of our plans build on the foundation of Medicare. A big factor was guaranteed issue. Folks wanted to make sure that if they were getting ready to retire and came down with a serious illness, that they were still going to be able to take advantage of this insurance. All of the plans that we offer are guaranteed issue group health insurance plans. So regardless of your health, you can't be turned down. Another factor was portability. Many higher ed individuals tend to retire around their community, but a lot also retire outside. So the plans that we offer today, you can retire anywhere in the country, whether it's Portland, Oregon, Portland, Maine, or anywhere in between. You can take these plans with you. They all look the same. The only difference will be the premium because they're based on the zip code that you live in. So all of these plans are portable. There's no, for some of the plans, there's no networks. So as long as the doctor, the physician, or facility accepts Medicare, they'll accept these plans. You've got a menu of options to choose from. On a national basis, we have 4 medical plans to choose from. Here in the state of Washington, there's two of the plans that we're offering on a national basis. We're still awaiting state approval, or Aetna is waiting state approval for those plans, and we're anticipating that that will happen sometime in 2011. So they'll be available in 2012. You have again, a menu of options, and the nice part about that is you can choose from plan to plan during open enrollment each year. So if you retire at 65, you're relatively healthy, you can choose a less rich, less expensive plan and conserve those assets that you've got built up in those accounts. And then each year during open enrollment, you can move from plan to plan. So if you come down with an illness, you can move into a richer plan, again, regardless of health. So it really gives you some flexibility. All of the plans offer catastrophic protection. So that's basically a out-of-pocket limit, and once you reach that, the plan will pay 100%. Prescription drug coverage, Medicare Part D approved, is all built within this program. We do provide some urgent care, again, which Medicare does not, for overseas travel, and preventive care. Some of our plans offer extended preventive care beyond what Medicare covers. Yes?
Does the catastrophic protection vary depending on the plan that you get, or is there just a general?
It varies depending on the plan, yeah, the limit, and we'll take a look at what some of those limits are, yes. So creating your own plan, again, when it comes time to actually retire and choose a plan, you're going to select a medical plan, you're going to combine that with a prescription drug plan, and then you're going to have the ability to add a dental plan to that also if you choose to, okay? So the plans that we have, again, for 2011, we have the one Medicare coordinated plan, and we'll go through some of the details of that in the addendum. The 2 supplemental plans are group like K&L plans. Again, those are the 2 that are not available in 2011 in the state of Washington. Again, we hope to have those available by 2012. And then the last plan that's available is the Medicare Advantage PPO plan. And that's the new PPO plan that is available for 2011 that replaces what we used to call private fee-for-service. So it's more of a networked type plan. And then we offer 3 prescription drug options, a high, medium, and low. And again, we'll go through those plans in a little while, along with the dental option. So what do you need to consider? Some of the things you need to think about when you're actually making choices on these plans. Risk reward. Do I want to pay a higher premium for less out-of-pocket expenses? Or, am I a little more of a gambler and want to pay a lower premium up front and bet that I'm not going to have as many out-of-pocket expenses in the future? So those are some of the things you need to consider when you're making your combination. With regard to the program itself, the Emeriti program, there are fees involved, account fees, if you will. The Emeriti service fee is $5 a month, and that's while you're actually actively employed as well as in retirement. SPU has been very generous, and they're picking up the Emeriti monthly $5 fee, so you don't have to concern yourself with that fee. The Fidelity record-keeping fee while you're working is $1.67 a month, and then that Fidelity record-keeping fee goes to $5.33 a month in retirement. And that's really when more of the heavy lifting is being done, all of the transactions with paying for the insurance. And then there's also the Fidelity investment management fee for the underlying freedom funds, which would be there regardless of where you chose those freedom funds. And then the only other fee that there is for that reimbursement account. We use a third-party administrator called Aclaris, and Aclaris allows you to bundle your receipts and send in 4 within a calendar year free. So what we tell people to do is shoebox all your receipts, send them in on a quarterly basis, and there'll be no fee involved. If you want to send in more, you can, but anything after that 4th submission there'll be a $6 fee. So if you're retiring before age 65, what do you need to do? Well, you're not going to have access to the post-65 insurance plans, but you do want to call the service center and let everyone there, let them know that who your dependents are and have dates of births and social security numbers available, and then you're going to link that again to your ACH electronic account for transfers. If you're retiring after Medicare eligibility, you will already be over age 65. You'll have enrolled in Medicare Parts A and B, so you want to have your Parts A and B numbers available, your Social Security number available, and at that point you're going to let the representative know, I want the richest medical plan and the richest RX plan, and then they'll take care of that for you and get you enrolled right over the phone through the service center. So different ways you can get information about Emeriti. Again, as I mentioned, the service center is staffed by both Fidelity and Aetna representatives who are trained in the Emeriti program. So if you have an investment type question, you can speak with a Fidelity representative. If you have an insurance type question, an Aetna representative would be more than happy to help you. You can visit our website. We've just updated and changed the website, and it's really much more robust now and much more user-friendly. We send out enrollment kits to you as you're getting ready to retire. A few months before you turn age 65, you'll receive a packet from us to kind of explain what you need to do and what your options are and what's available. We send out periodic newsletters to active employees via electronic format, and also to retirees via the mail. And then on-campus workshops. Coming from higher ed, our commitment to education is paramount. So each year we're committed to coming to the campuses of all of our member institutions and doing workshops for younger employees, those thinking about retiring, and those folks who have retired, just to kind of keep you abreast of what's going on with our program and maybe what some of the changes are with the Medicare. And I want to get to just a quick highlight on how some of the healthcare reform changes will affect our programs. As I mentioned before, with your question about some of the changes in the donut hole, there'll be a 50% discount on brand name drugs once you reach the donut hole at point of sale, as long as the pharmaceutical company that manufactured the drug is participating in the program. If you're using a generic drug, there'll be a 93% cap, or in other words, a 7% discount for generic drugs in the donut hole. The Part C changes, again, as I mentioned, they went from the private fee-for-service to that Medicare Advantage PPO network type plan. Part D, and I don't think I mentioned this before, previously before the healthcare reform, when you retired and enrolled in Medicare Parts A and B, they gave you one free physical for your life, and that was it. What they're doing now is they're extending that, and they're going to give you a wellness exam on an annual basis. So that will be covered. They're also expanding coverage for children up to age 26. And then the reimbursement benefit, we kind of talked about this before, that you need the prescription for over-the-counter medications to actually get reimbursed for. So understanding how the Medicare plans work, the Aetna Traditional Choice, and again, these are the three plans that we offer. The Traditional Choice is our richest plan, and it's it coordinates with original Medicare, so it has a deductible. You have Parts A and B are covered by your deductible, and generally after you pay your deductible, and for this year the deductible was $200, the plan pretty much pays 100%. So it's a very rich plan. The Aetna supplemental K&L plans, again, they're not available for 2011. I won't go into great detail, but those are supplemental type plans, kind of like a Medicare, Medigap plans. And then the Aetna Medicare Advantage, that's the PPO. And that's, again, where I mentioned before, you're assigning your rights, your Parts A and B over to a private carrier, and they become the primary payer for you. So that's kind of how it coordinates. Yes?
These amounts are all different if you have pre-65 spouse, right?
The pre-65 coverage is different, right? So And the way that works is that the retiree or the employee is the trigger. So if the employee retires, say at 67, and you have your spouse is 63 or 64, he or she is then on the pre-60, if you want to take advantage of it, you're on the pre-65 coverage. And those rates are somewhat higher because they're not supported by Medicare at that point, and they're not also being offset by a younger working population. They're the true cost of that 60 to 64 age group, and it is expensive. Yes?
Just briefly comparing the traditional choice and the PPO, does the PPO pretty much pay for everything too?
The PPO, I think it may be the next slide, and we'll walk through an example of how that works. So these are what the coverages are, and we can, if you go to our website, you'll be able to look in more detail as to actually what the coverages are, but this is kind of the highlight. So the traditional choice and the Medicare Advantage plan are the two that are available here. So you have a $200 deductible. Traditional choice, once that deductible is paid, for the most part, plan pays 100%. So it's a very rich 100% coordination of benefit plan. And I think you had a question before about the out-of-pocket limit. So in this particular plan, it's $1,250. So once you reach that $1,250, the plan would pay 100%. Okay. And then the Medicare Advantage plan, that's the one where you're assigning your rights over, the Parts A and Part B to the carrier. In this case, it would be Aetna. In network, there's a $300 deductible. Out of network, it's a $500 deductible. And then there's a 15% co-insurance. And then you can see the out-of-pocket limits are somewhat higher on that particular plan. And I think we have an example. Let me go to the example. I'll go to the example next. No, I'm not sure it's in here. So yeah, so basically, once you pay your deductible on this Medicare Advantage plan, you're going to pay 15% of whatever the expense is. So let's say you had a $100 doctor's bill, and you've already satisfied your deductibles for both of these plans. For the traditional choice, this plan would pay the $100 deductible. For the PPO plan, the plan would pay 85%, and you would pay 15% or $15. Yes?
I didn't hear what you said on the 20% co-insurance on the traditional. You've got your deductible satisfied, you go to the doctor, it's $100. So are you going to be $20 then on the traditional? Because it says 20%
No.
co-insurance.
Yeah, it's once you've met or satisfied your deductible on that plan, for the most part, with few exceptions, that plan will pay 100%. So you won't.
So what's that?
So that 20%.
Go.
Yeah, that only comes into play in a couple of situations where if you've extended your stay in a facility or something like that. But for the most part, it'll pay 100%. So it's a very, very rich plan. And the prescription drug plans, again, these are all Medicare Part D approved plans. Starting on the right, that's looks much more like the standard Part D plan. It's got a standard formulary. It has the $310 deductible, which is a Medicare Part D deductible. And the coverage limits are 15% co-insurance for generics, 30% for preferred brand drugs. And then in the coverage gap, that donut hole, there is no coverage at all with this plan. And then once you've gone through that donut hole, then you're going to have a 95% coverage. So this is very similar to a standard Medicare Part D option. The mid plan now expands the formulary to an open formulary. The deductible goes to $100, and now you have coverage for generic, preferred and non-preferred brand drugs with 15%, 30%, and 15% co-insurance. And now we're starting to provide some coverage in that donut hole for generic coverage only. Okay, and then once you've gone through the catastrophic true out-of-pocket limit, you're at 95% coverage. And then the RX High plan is the richest medical plan that we offer. Again, it's an open formulary, $100 deductible, 15, 30, and 40% on those generic preferred and non-preferred brands, but there's full coverage through the donut hole. So if you're someone who needs to take a large amount of prescription medication, this would provide you full coverage through that donut hole. If you're someone who only takes a couple of maintenance drugs, maybe the RX Low plan would be better for your situation. And you're actually able to call the service center with a list of your medications, and they'll work through you to see which plan would actually work the best for you.
Excuse me?
Yes.
Can you switch plans?
Yep, during that open enrollment each year, you can switch plans. So that's what I mentioned before. If you're relatively healthy, you can take a less rich medical, less rich drug plan, and then as your medical conditions or financial conditions change, you can move into different plans year to year during the open enrollment. And then there's a dental option for the coverages also. Typically, you don't find dental insurance for retiree health, but we offer a program. There's a $1,500 annual max. 100% of your preventive services are covered, and there's 50% for your basic services and your major services with a $100 deductible. If you do move into this plan, there is a 12-month waiting period for major services if you didn't have coverage prior to moving in. So if you're coming from another dental plan, there's that waiting period is waived. But if you don't have coverage, you need to wait 12 months for it. Yes?
We've had coverage, but they told me we had to wait 6 months. Is that?
The 12 months is new. It was 6 months last year. Yeah. You say you're currently have the dental plan? Yeah. Yeah, this is starting effective January 1st. It went from 6 months to 12 months.
But what they told me was it didn't matter if we had continuing coverage. We still had to wait 6 months.
You had previous coverage? Okay, if you want to see me afterwards, yeah, because if you can provide proof of existing coverage, then that 6 month period should be waived. Yeah, yeah. And so this went from 6 months to 12 months, as you mentioned. And also, you used to be able to move in and out of dental coverage at any point. Now, you don't have to take it right away, but once you enroll in the dental plan, if you disenroll, you can't go back in. So you can't jump back and forth into the plan. And that's something you were able to do. Yeah. So yeah, if you want to see me afterwards, okay. And this was just a composite rates for the plans on a national average. And I've actually, if you want to see what the rates look like, if you didn't take them already, I had some rate sheets printed out for the actual zip code here at Seattle Pacific to give you an idea of what the 2011 rates are going to look like. So that sums up the program. I know we covered a lot in a short period of time. I'd be here to answer any of your questions. Any questions right now? Yes?
Are there exclusions in the traditional plan? I mean, procedures that are excluded, or one concern is if you need extensive chemotherapy, for instance, for cancer, is that covered totally?
Yeah, in our plan comparison chart, we'll give you some more details, and that you should be able to find the 2011 on there shortly. We're waiting any day to have that available, so we should be able to look for that. And if you have detailed specific questions, you can always call the service center, and they should be able to help you out on coverages, like that. Yeah.
The
Yes.
deductible January 1 to December 31, so we're just enrolled, we have to satisfy the deductible between now and December, and that's starting.
Right. All Medicare plans are on a calendar basis. They start January.
For us, non-Medicare homes. Pre-65 stuff.
Are you on the pre-65? Yeah.
So,
Yes. Yeah. Any other questions? No?
I have
Okay.
a question for you in particular.
Okay. All right. Well, thank you all for coming. And again, if you do have any questions or want to get some more information, you can always go to the website. This presentation is available on the website. If you'd like to if you have any questions for Carrie, or specifically if you'd like to have her ask me to assist you, I'd be more than happy to do that. Okay, thank you.